Resolved, America has government health insurance, but I disagree. What is the point of Obamacare if it doesn't do much good? There are many reasons Obamacare should not exist. Here are a few of them. Medicaid does not help everyone who needs it. It is very challenging to help the homeless, to provide Medicare to the homeless, and only 37% of Americans approve of it. There are two different types of health insurance, private health insurance and public health insurance. Private health insurance is provided by private companies and is paid for through private sources. Public health insurance is provided by the government. There is also different services that help different people according to their needs. For instance, Medicaid helps the needy and Medicare is provided for people over 65. They are both federally funded programs and they pay for about 80% of your medical expenses. According to New York Times reporter Annie Laurie, only a fraction of people are able to get Medicaid or Medicare. There are many people that are in a very desperate situation and cannot wait any longer and do not have the time for these programs and deny them. Therefore, Medicaid or Medicare does not help everyone right away who badly needs it. Medicaid may help the homeless, but it is very difficult to get them in. According to Annie Laurie from New York Times, homeless people do not have the necessary information like email, permanent address, or phone number. It is great that they are trying to help the homeless, but we need a better solution. Only 37% of Americans approve of Obamacare. According to a 2013 poll by Henry Kaiser Family Foundation, 37% of Americans like Obamacare and 40% disapprove. That is less than half of people that agree. Therefore, any kind of health care programs are not convenient because Medicaid and Medicare do not help everyone who badly needs it. It is very difficult to provide Medicaid to the homeless, and less than half of Americans approve of it. So what good is Obamacare? The answer is no good.
My opponent may say that giving Medicare to homeless people is too hard because they don't have any information that can help them receive it. But we disagree because even though it may be hard to give them Medicare, they still deserve it. They are out there with nothing else and they need our help, and without it they may not survive. That is why we believe Medicare should be for everyone, even homeless people.
Obamacare is a health insurance for people who really need help. Obamacare helps out people who need help and don't have anything. Based on my research, other health care plans, you have to wait until your plan is up to switch if you want. But with Obamacare, you don't. Because they have options, they can only get the help they need and not anything more. According to Kathleen Sebelius, 50 to 99 employees have until 2016 to complete with the mandate they provided. With Obamacare, you can switch if you want and you don't have to pay because it is free. 30 million people have signed up for Obamacare, and just by them signing up is showing that they should not repeal it. Obamacare helps out with people who need health insurance but can't afford to pay them. With health care insurance, you have to wait till you're... I think I just read that. 30 million people are joining, and just by them joining, it is making us wealthy and showing them why they should not repeal it. They provided 300,000 jobs for people who need help. Federal government is projected to spend 20% more on Medicaid while spending on private health insurance. Is expected to rise 9.4%, which means that spending more money on government health care will be less than spending money on private health care. Therefore, they should not repeal health care because a lot of people use health care and depend on Obamacare insurance.
My opponent may say that government health care is cheaper than private health care, or in our case, free. But I disagree. According to Paige Cunningham, a reporter for the Washington Times, health costs have been rising faster than inflation for years, threatening to eat up an even greater share of the federal budget and private sector spending. Therefore, even though my opponent may say government health care is cheaper, my research proves otherwise.